All right, so here is my audience today.
My name is Ryan Dean, and my informative speech is on a history of pre-hospital care. So imagine it's 2 a.m., you've had a long day of transfers, helping old ladies get back up, and taking people with the flu to the waiting room. You just got back to your post and closed your eyes. The tones go off again for a vehicle versus motorcycle. It's 15 miles from your post, it's foggy, so no helicopter support. Just you, your partner, and maybe a fire crew or two. You arrive on scene, you see one firefighter doing CPR on an adult male whose injuries you can already see are incompatible with life. There's two other firefighters frantically strapping an adult woman to a backboard. You can see her left leg is completely amputated and her arms look fractured by the way they're flopping around. As soon as you get there, everybody's looking at you for what to do next. And now this woman is yours. For the next 15 minutes, probably longer, she's looking at you to keep her alive until you can get her to a trauma center. This is what it's like to be a paramedic. So why is this a thing? EMS. Where did it come from? Let's start with me. For about 1/3 of my life, I've been working on an ambulance. It's been a major part of my life and probably the biggest reason I want to go into nursing. Perhaps some of you have been on an ambulance, or maybe someone close to you has. Either way, good or bad, the EMS service can have a lasting effect on some people. So I'm going to share with you some of the history of pre-hospital care and how it has become to be what it is today. Also, when it is a good time to go to an emergency room or call an ambulance. So let's dig deeper into the history of EMS. EMS is thought to have started back in the early 1800s when Napoleon Bonaparte's chief physician created a system to treat and transport injured soldiers. Also, some Civil War tactics were used for civilian emergency services. In the early 1960s, things began to change. We recognized that we needed to focus on pre-hospital care because heart disease, strokes, and trauma were the number one thing killing people. But the initial results were disastrous. The American Red Cross states that in 1960, only 6 states had standard courses for rescuers, 4 states had regulations for ambulance design specifications, and fewer than half of all EMS personnel had received minimal training. So in 1966, the National Academy of Science National Research Council had some obvious concerns. They wrote up a comprehensive report titled Accidental Death and Disability, the Neglected Disease of Modern Society. It's pointed out that there were no treatment protocols, lack of new communication equipment, and lack of research for pre-hospital care. It would help change EMS into what we know it as today. So this was the beginning of pre-hospital care and regulations. While there were many defining events in its history, some noteworthy ones were in 1978, Dr. Jeff Clausen created a system for prioritizing and triaging emergency calls, like someone with chest pain is a higher priority than a nosebleed. In 1984, EMS for Children and the National Association of EMS Physicians was created. They were major parts in our education, research, and treatment pre-hospital personnel provide. In 2001, September 11th, when multiple hijacked airplanes were flown into the World Trade Centers and Pentagon, 403 first responders died that day, along with 2,977 civilians. From this, we framed the Department of Homeland Security and were able to see major holes in EMS communications, like interoperability between agencies. That's what EMS is and where it came from. But when is a good time to call 911? First ask, what is a medical emergency? Emergency care for you states that an ambulance is needed when the condition is life or limb threatening, the condition could worsen quickly, if moving the victim will cause further injury, the victim needs skills or equipment that the paramedic or EMTs carry right away, and would distance or traffic cause delay in getting the person to the hospital. Now how about when we shouldn't call an ambulance? If your dog is barking, your eyelash is hurt, you have minor cold or flu symptoms, or you have a mild cut that's barely bleeding or not bleeding at all. Just try to use common sense when you call your doctor, go to an urgent care, or call an ambulance. So now if you didn't know, you have a brief context of what emergency medical services is, specifically what pre-hospital practice and care is all about, like where it came from, its rough edge beginnings that led to smoother, well-researched, and organized system it is today. EMS has come a long way. from an empty bus with a cot to basically a one-man emergency room. We keep hearts beating, we deliver babies, and we treat critically ill patients that are on the verge of death. Or maybe we just hold your hand on the way to a hospital because you're scared and alone and we are all you have right now. Whatever it is, I'm glad I was able to share some of its history with you today. Thank you.